My name is Santana, and I'm going to be going over my third case study. I'm going to begin by going a little bit over my client's information, just a brief review about what I've been going over in my previous two case studies. So my client recently turned 6. She's diagnosed with ASD level 3. She receives 40 hours of ABA therapy per week and can communicate with 2 or more word approximations. The behavioral target we are tracking is tantrums, and this is the operational definition we have listed below. Basically, an instance begins when she engages in one or more of the following behaviors: yelling, climbing, putting non-edible items into her mouth, attempting to disrobe or disrobing, swinging items around in her circle, and crying with or without tears. And then a tantrum ends when she's no longer engaged in these behaviors for at least 3 minutes. I did go over antecedent and consequence strategies in my previous case study, number 2. So if you'd like more information about that, go ahead and check out that video. I can also link it down below in the description box. And next, I wanted to go over the training model that we use to train new therapists on how to manage your tantrum behaviors. So we use behavior skills training, or BST, and this is basically an instructional hierarchy that helps teach new skills and helps new therapists become fluent in these skills. So BST includes providing instructions, modeling the skill, then practicing the skill, and then providing feedback or getting feedback from your trainer. So basically, first the trainer will describe the current behavior intervention plan, then model and demonstrate the skill during role plays. And then the trainee gets to practice the skill with the client during behavior management. After they practice applying the antecedent strategies from the BIP, they can practice the consequence strategies and actually managing the behavior. And then once they do this, they're given feedback from their trainer to improve their skill. So training is performed by designated team trainers that have the knowledge and experience in working with this client. So the outcomes are usually really well, and we have well-trained therapists on this client's team. I'm just going to go into depth more about each of these steps. So first, again, we have instructions. Instructions can come verbally from your trainer. They can be written instructions, or they can be video instructions. A combination of either or all 3 would be best. Instructions also include explaining why these strategies were chosen and how it will help the problem behavior. And it also, instructions explain how to implement the strategies. So again, implementing like antecedents versus consequences. And then instructions also lay down the foundation for demonstration. So you get to kind of hear what you're going to learn about and then practice. After instructions, we model the skill. So the trainers will demonstrate the skill with just the new hire, and then the trainers will demonstrate the skill with the client. And then the new hire gets to practice their skills. The new hire will practice a skill with their trainer, and then once they meet that criteria, they get to practice with the client, managing the behaviors and applying consequence strategies according to the BIP. The new hire then trains and practices the skill until mastering 80% or more on the behavior management integrity checklist and is comfortable managing the tantrum behavior. As for feedback, the trainer provides feedback on the implementation of the skill. This can be either positive feedback, which includes highlighting and praising the steps that were implemented correctly, and then also corrective feedback, which includes indicating the steps that were not implemented correctly or not as intended, and follow up with more training. Next, I'll go over validity and fidelity. As we know, BST has been found to be an efficient and effective training method when teaching new skills. To ensure validity and treatment fidelity, we frequently observe and monitor performance of staff with the clients, in addition to additional training as needed. In addition, we also monitor treatment integrity and collect IOA data using client-specific integrity checklists. And we do this about every quarter or, again, as needed for extra training. This is the integrity checklist that we use for my client's behaviors. You can see that we have one specifically for climbing, one for object mouthing, and then one for tantrums, as they kind of all do go together. So this is what it looks like. I can kind of go over some of the steps. So most of them have like antecedent strategies. Are they implementing it during their sessions? Are they following up with consequence strategies when the behavior occurs? So many of them, as you can see, will say BTs provide access to preferred items such as puzzles, dolls, magnet tiles. So this is an antecedent strategy on the BIP. And it's so long as they're doing this, we'll put a plus. There's other stuff like implementing and ensuring safety for climbing and object mouthing. And then also just following through with the consequence strategies as we have written them for her tantrums down below. And that is the integrity checklist. This checklist also includes like a child-led teaching protocol, a manding protocol, and then also her toileting protocol. And then so this whole checklist is done throughout observation, but I just wanted to highlight the behavioral items in the checklist. Lastly, I'm going to go over the relevant task list items that were relevant to this assignment. So I'll start with B1, defining and providing examples of behavior, response and response class. Next, we have B4, defining and providing examples of positive and negative reinforcement contingencies. B7, defining and providing examples of automatic and socially mediated contingencies. C8, evaluate the validity and reliability of measurement procedures. F6, describe the common functions of problem behavior. G5, using modeling and imitation training. G7 is using shaping. G21, use procedures to promote stimulus and response generalization. G22, use procedures to promote maintenance. I4 is train personnel to completely perform assessment and intervention procedures. I5, using performance monitoring, feedback and reinforcement systems. And lastly, I6, which is using a functional assessment approach to identify variables affecting personnel performance, sorry. And that is my case study 3. Thanks for listening. Bye.